Hey, thanks for joining us today. If you're considering Medicare or turning 65 or new to Medicare, we've created this 3-part series just for you. On this first video today, we're going to be covering what is Medicare, Medicare basics, and the costs of those general Medicare basics. So let's get started. So what is Medicare? Medicare is the federal program through the government that provides health insurance for those age 65 and older, or if you're under 65 but on Social Security disability, you can access Medicare as well. So why is this important? It's important to know the ins and outs of Medicare because typically when most people are working, they get their health insurance through their employer, and their employers narrowed down the options, so they only have a few to select between. But when you turn 65 or enroll in Medicare, you literally have hundreds of different options available to you out there. Different insurance companies, different types of plans, and it's all based on where you live as well. There's a whole variety of information. So today we're going to explain a little bit more about those ins and outs. All right, let's start with first things first, original Medicare. So the basics. This is your Part A and your Part B, your red, white, and blue Medicare card that you receive from the government. So Part A, that's your hospitalization. Part B, on the other hand, that is the doctor's side of things. Part A, there's no premium associated with this. You've paid taxes your whole life for this. Part B, on the other hand, this does have a monthly premium. It's deducted directly out of your Social Security check if you're drawing Social Security, and they take this premium based on income. Did you know that original Medicare Part A and Part B has no maximum out of pocket? So if you had a surgery coming up, you could truly spend thousands and thousands of dollars on your health expenses. A company like ours can help you avoid those costly expenses. So continuing on after Part A and Part B are Part C and Part D. Original Medicare, your red, white, and blue card from the government, that Part A and Part B, that does leave some gaps. And that's where Part C comes in. This is also another name for your Medicare Advantage plan. You purchase these directly through private insurance companies, and they cover both your health coverage as well as your Part D prescription drug coverage, which is the next part. So like I said, Part D, on the other hand, is the prescription drug type of thing. When I was learning this industry, I thought, I don't take any drugs. Why would I want to purchase a Part D drug plan? Well, it's a lot like auto insurance. I also don't plan on getting in a car accident, but I have to have auto insurance. We're going to get a lot more into the Part D drug plans as well as Medicare Advantage and Medicare supplements in Part 3 of this video series. All right, next we're going to talk about the costs associated with Medicare. So there's really 4 different areas we're looking at here. Number 1 is premiums. Number 2 is deductibles. Number 3 is copays, and number 4 is coinsurance. So first, premiums. This is the amount that you pay to a private insurance company or to Medicare each month to ensure that you have health insurance. Number 2 is deductibles. Now this is the amount that you pay before your coverage really kicks in. And if you're working, most people understand that typically on employer plans, you have higher deductibles. The good news about Medicare, on the other hand, is typically there's first dollar coverage or much lower deductibles. So we're not looking at the thousands and thousands of dollars of deductibles like there are with employer plans. The third is copays. This is a set dollar amount that you pay for different services you use throughout the year. You typically know what these dollar amounts are going in before you enroll in the plan. And the last is coinsurance. And the thing to keep in mind with coinsurance, this is a percentage of your health costs. And the thing to keep in mind is you don't typically know what the percentage, what that total dollar amount will be that you're going to pay a percentage of. Join us for Part 2 when we talk about the right time to go on Medicare and how to enroll in a Medicare plan.